Tonight from the State House, a bipartisan medical debt bill that aims to keep you from racking up this kind of debt passes out of committee.
As CBS 4 State House reporter Hannah Adamson explains, lawmakers revised significant portions of that bill before moving it forward.
After weeks of back and forth, Senate Bill 317 passed unanimously out of committee Wednesday, although its ultimate fate when it gets to the Senate floor has yet to be seen.
I'm cautiously optimistic.
If State Senator Fadi Kadura's bipartisan medical debt bill is passed, all Indiana hospitals would need to give patients information about charitable assistance and payment plans.
People do not choose to have medical debt because they never chose to have a cancer or a chronic illness.
The bill stipulates a given plan must allow payments to be made over a period of at least 2 years. A monthly payment may not exceed 10% of a person's monthly income.
And it requires hospitals to engage with patients to design a payment plan that works for Hoosier families who can't afford these services.
Lawmakers changing large chunks of the bill before passing it out of committee. One deleted provision would have required hospitals to provide good faith estimates to patients before they receive services. Another would have required hospitals to stop reporting medical debt to consumer reporting agencies.
So we had to make some changes to the bill based on changes in federal law.
The bill still protects wages from being garnished and prevents liens from being placed on homes due to medical debt, but only for Hoosiers making less than 250% of the federal poverty level. For a family of 4, that means an amount less than $78,000, according to the Department of Health and Human Services.
I don't believe that people should just be able to waive their debt.
State Senator Liz Brown voted to pass the amended bill out of committee Wednesday after the income limits were revised.
Well, I think as long as we can keep it where it is now, the amendment I thought was a good step in the right direction. But if the author of the bill tries to go backwards and expand it, then it's going to be a problem.
The bill will need to pass a second reading on the Senate floor next Wednesday and will need to pass out of the Senate altogether and make its way to the House by next Thursday in order to survive. Reporting from the Indiana State House, I'm Hannah Adamson.